Hello friends. Today we are understanding the anterior cruciate ligament injuries, its causes, signs, symptoms, and the physiotherapy assessment and management. So first, before starting the video, I would like to ask, have you ever experienced a sudden knee injury, heard a popping sound, or struggled with knee instability? So if so, you might have injured with anterior cruciate ligament. In today's video, we will discuss what an ACL injury is, its causes, signs, symptoms, different grades of injury, and how physiotherapy plays a vital role in the recovery of ACL injuries. So, starting the video, we will discuss about what is ACL injury. The ACL is anterior cruciate ligament, is one of the major ligaments in the knee. It provides stability by preventing excessive forward movement of the tibia and controlling the rotational forces. So, ACL injuries often occur during high impact activities or sudden movements that put stress on the knee joint. What are the common causes of ACL injury? This includes sudden changes in the direction, that is, quick pivot or sharp turns in sports like soccer, baseball, or tennis can strain the ACL. Landing incorrectly from a jump. Likewise, sports that involve frequent jumping, such as volleyball, gymnastics, increase the risk of ACL tears, especially if the landing technique is poor. Or direct impact or collision, overstretching, or hyperextension of the ligament, weak muscles, or poor biomechanics, that is, insufficient strength of the quadriceps or the hamstring muscles, or poor movement mechanics, increases the vulnerability to the injuries to the ACL ligament. Now, the other propositions are genetic and the anatomical factors. That is, some individuals have a higher predisposition to ACL injuries due to factors such as ligament laxity or specific bone alignment. Now discussing about the grades of ACL injury and their treatment approaches. So ACL injuries is further bifurcated in three grades. Grade 1, that is mild sprain, grade 2, that is partial tear, and the grade 3, that is complete tear. So grade 1 comprises of the ligament is stretched but not torn. Mild pain will be there and the swelling will be present. So it can be treated conservatively with rice, that is rest, ice, compression, and elevation. And physiotherapy will be basically focused on strengthening and stability of the structures. Now coming up to the second grade, that is your partial tear. The ligament is partially torn but still provides some stability. Moderate to mild swelling, pain, and occasional instability may be experienced by the patient. And the treatment will include the combination of bracing, therapeutic exercises, and potentially platelet rich plasma therapy to promote healing. Now coming up to the third grade, that is grade 3, complete tear. Ligament is fully torn and the knee is highly unstable. Severe pain, swelling, and an instability to bear weight will be there. And the treatment mostly comprises of surgical reconstruction, which is usually recommended, followed by an extensive physiotherapy program to restore the function and prevent re-injury to the patient. Now, coming up to the common signs and symptoms of ACL injury, this includes the popping sound at the time of injury, severe pain, swelling, instability, or giving way. That means a feeling of the knee buckling or being unable to support weight, especially during the movement, reduced range of motion, and tenderness around the joint. Now, coming up to the physiotherapy and assessment, that basically comprises of some special test that includes Latchman test, which evaluates the forward movement of the tibia to assess ACL integrity. Anterior drawer test, which checks the knee stability by assessing anterior displacement. Another test is pivot shift test that determines the rotational instability in the knee. Some of the radiological imaging can also help confirm the severity of the injury and assess the associated damage. That includes the MRI and other imaging tests. Now, coming up to the physiotherapy management and treatment. So, as discussed earlier in grade 1, RICE, that is rest, ice, compression, elevation to reduce swelling and pain, bracing and crutches to stabilize the knee, quadriceps and hamstring exercises to rebuild muscle strength, range of motion exercises to restore knee flexibility, exercises to improve joint stability and prevent future injuries. Then progressive load and functional movements with controlled weight bearing activities and post surgical rehabilitation if the surgery is indicated. So, if you experience persistent knee stability, severe pain, or recurrent swelling, even the conservative management in grade 1 and grade 2 tier, then also it is strongly recommended to consult a orthopedic surgeon for a opinion. So, here we have discussed everything in short about the ACL injuries and its causes, signs, symptoms, grades, physiotherapy assessment, and management. So, it is clear that an ACL injury can be challenging, but with proper assessment and a well structured rehabilitation plan, recovery is absolutely possible. If you or someone you know is dealing with an ACL injury, consult us today. Don't forget to like, share, and subscribe for more sports related injuries and insights. Thank you for watching my video.